If you've ever been told it's probably just hormones, it's just perimenopause, or bleeding can be unpredictable at your age, there's one symptom that should always be taken seriously: bleeding that's unusual for you, especially bleeding after menopause. Endometrial cancer, often called uterine cancer, is one of the most common gynaecological cancers, and awareness matters for a simple reason. It's often picked up early because it commonly causes bleeding, which gives you a clear prompt to get checked. In this video, we'll explain what endometrial or uterine cancer is, the symptoms to watch for, who's at higher risk, what happens at the GP and in clinic, and when you need urgent help. And yes, because it's important to be honest, endometrial cancer can spread if it isn't found and treated. In more advanced cases, it can spread beyond the pelvis, including to organs like the lungs. And even at that point, doctors still treat it as endometrial cancer and not lung cancer. That is interesting to know. This is why we always advise that you go to see your doctor if anything is wrong, because no amount of inhalers or cough mixtures you buy in this case, for example, would help adequately without dealing with the root cause first. That's not to frighten you. It's to underline why timely assessment of abnormal bleeding matters. The uterus, also called the womb, has a lining called the endometrium. Endometrial cancer starts when cells in that lining grow abnormally and form a tumour. Most cases happen after menopause, but it can happen before menopause too. And because it involves the womb lining, symptoms often show up as changes in bleeding patterns. That's why noticing bleeding changes matters so much. The main symptom to know is bleeding after menopause. If you've stopped having periods and then you have any vaginal bleeding, even a small amount, it should be assessed. Before menopause, the symptoms are usually bleeding patterns that are new for you and persistent. That can include bleeding between periods, much heavier bleeding than usual, periods that become very prolonged or irregular in a new way that doesn't settle, and bleeding after sex. There are other causes for this too, but it still deserves assessment. Another symptom is unusual vaginal discharge, especially if it's watery, pink, blood-stained or persistent and new for you. Some people also notice pelvic pain or pressure. It's less common as an early symptom, but it matters if it persists or worsens. And symptoms like unexplained weight loss, fatigue, or loss of appetite can be relevant too, especially alongside bleeding changes. A key point here is that perimenopause can cause irregular bleeding. The difference is a new pattern that persists or bleeding that feels out of keeping with your normal. Perimenopause can absolutely change your cycle. You can get shorter cycles, longer cycles, heavier or lighter bleeding, and spotting. But the problem is when abnormal bleeding gets automatically labelled as just hormones, because conditions that need treatment can be missed. So the safest approach is simple: don't self-diagnose. If bleeding is new, persistent, heavy, or unusual for you, get assessed. You aren't being dramatic, you're being sensible. There are plenty of non-cancer causes of abnormal bleeding. Things like fibroids, polyps, adenomyosis, endometriosis, hormonal contraception effects, infections, and cervical causes such as ectropion or cervicitis. And of course, changes linked to perimenopause. But because endometrial cancer is also on the list, especially with postmenopausal bleeding, the correct next step isn't guessing, it's getting checked. Risk is influenced by a mix of biology and life factors. Higher risk is associated with age because it's more common after menopause. Higher body weight can increase risk because fat tissue can increase estrogen exposure. PCOS can be relevant, especially where there's irregular or absent ovulation. Diabetes is also linked with higher risk. Long-term exposure to estrogen without enough progesterone can increase risk too. That can be related to things like early periods, later menopause, or certain HRT patterns. Never having been pregnant is also a risk factor, but it's not something anyone should feel judged for. Tamoxifen use in some cases can increase risk, and family history or genetic syndromes, such as Lynch syndrome, can be relevant too. These factors guide clinicians, but they're not a verdict. Endometrial cancer can happen without obvious risk factors. Here's why doctors take postmenopausal bleeding seriously. When endometrial cancer is found early and still confined to the womb, it can often be very treatable. But if it isn't detected and treated, it can spread beyond the uterus into nearby tissues and lymph nodes, and in more advanced cases to distant organs. One place it can spread to is the lungs. For most people watching, the main takeaway is this: early assessment of abnormal bleeding is protective. And if you ever have gynaecological symptoms alongside new, unexplained respiratory symptoms, like a persistent cough or breathlessness, that deserves medical advice too. If you see your GP for abnormal bleeding, they'll usually take a detailed history. That includes your bleeding pattern, whether you're pre, peri, or postmenopausal, any pain or discharge, medications, contraception, and whether pregnancy is possible. If bleeding is heavy, they may check for anemia with blood tests. With your consent, they may do an examination, which can include a speculum exam and a pelvic exam. They may also arrange swabs if infection is possible, and they may refer you for investigations, often including a transvaginal ultrasound to look at the womb lining and check for polyps or fibroids. You might also be offered an endometrial biopsy, which is a sample of the womb lining, and sometimes a hysteroscopy, which is a camera test to look inside the womb. Being referred urgently doesn't mean you have cancer. It means the system is designed to investigate these symptoms promptly. Seek urgent medical advice if you have heavy bleeding, like soaking pads quickly, passing clots, or feeling dizzy or faint. Also seek urgent advice if you've got severe pelvic pain, fever, or you feel very unwell. Bleeding after menopause should be booked promptly, even if it's small. And if symptoms are rapidly worsening, or you've got unexplained weight loss, don't delay. And if you feel your concerns aren't being taken seriously, it's okay to ask for a second opinion.
If you want a simple script, try this. I'm having bleeding that's unusual for me. I'm postmenopausal or perimenopausal or premenopausal, and this is new and persistent. I'm having bleeding between periods, bleeding after sex, heavier bleeding, or watery or blood-stained discharge. I'd like to be assessed and referred for the appropriate investigations. And if tests are normal but symptoms continue, what's the follow-up plan? You're not wasting anyone's time. Abnormal bleeding is a valid reason to be seen. Endometrial or uterine cancer is a serious topic, but there's a powerful message here. The body often gives an early warning through bleeding, so if you notice bleeding after menopause or a new and persistent bleeding pattern that doesn't feel right, please get checked. Most causes aren't cancer, but the only way to know is proper assessment. You deserve clarity, reassurance, and care. Abnormal bleeding can have a few different causes, and not all of them are cancer. Conditions like adenomyosis can also drive heavy, painful, or prolonged periods and pelvic pressure. So tap the thumbnail on your screen now to watch our adenomyosis video, where we break down the symptoms, diagnosis, and treatment options.